Experts speak on child psychology with cognitive development, a presentation by Brittany Falgo. A brief overview of child psychology and cognitive development. Child psychology is a specialized branch of traditional psychology that focuses on children, mainly with their development and their behavior. Child psychology focuses not only on the physical growth of a child, but also on their mental, emotional, social, and development progressions as well. Child abuse is a form of domestic violence, and emotional abuse are behaviors used by a person in a relationship in order to gain control. Child abuse consists of any act that endangers or impairs a child's physical or emotional health and development. Child abuse occurs in many forms: physical abuse, sexual abuse, neglect, and emotional abuse. Is spanking your child considered a form of abuse? Are children affected by spanking? We will introduce two experts. Expert one is Sandra A. Graham Berman. She has a PhD and she's an associate professor at the Department of Psychology and Women's Studies, University of Michigan. Dr. Graham's primary area of focus has been the impact of different forms of family violence on children's social and emotional adjustment. Dr. Graham is also a regular consultant to the local domestic violence programs and at Head Start schools. Expert number two is Alan E. Kazad. He has a PhD from Northwestern University. He graduated in 1970, and he is now a professor at the Institute of Social and Policy Studies. He is the director of the Yale Parenting Center. He is the John M. Muzzer Professor of Psychology, Child Psychiatric, and the Institute of Social and Policy Studies at Yale University. His clinical work and research focuses primarily on the development, treatment, and clinical course of oppositional, aggressive, and antisocial child behavior. Sandra Graham Berman, with a PhD, has a growing number of research has been shown that spanking children and use of the other forms of physical discipline can pose serious risks to children, but there are still many parents that are not receiving the message. It is a very controversial area, even though the research is extremely telling and very clear and consistent about the negative effects on children. There are many studies that show the use of physical punishment, including spanking, hitting, and other aggressive means of punishment, can lead to increased aggression, antisocial behavior, physical injury, and mental health problems for children. About 94% of American 3 to 4 year olds have been spanked by a parent at least once during the past year. Yet, most clinical child psychologists would never suggest parental spanking, and 1/3 consider a suggestion always unethical. There are many studies that show physical punishment, including spanking, hitting, and other means of causing pain, that can lead to increased aggression, antisocial behavior, physical injury, and mental health problems for children. But spanking doesn't work. You cannot punish out those behaviors that you do not want. There is no need for corporal punishment based on research. We are not giving up an effective technique. We are saying this is a horrible thing that does not work. Corporal punishment / discipline, such as spanking, has been associated with adverse mental health outcomes such as poor school achievements, behavioral problems, lowered self-esteem, and child delinquent behavior. When we compare and contrast the two experts, Sandra A. Graham consists that spanking poses serious risk. It leads to aggression and overall has a negative effect on children. Alan Kazad, he says that corporal punishment is not needed. It causes mental health problems and it leads to antisocial behavior. Together, a common entrance that they both have is that spanking doesn't work.